Hey everyone, welcome to this week's conversation with Dr. Stephen Nedd about the body and how to fix, protect, or maintain it using outside-the-box alternative solutions. If you're a big fan of the pharmaceutical or surgical approach, you are so in the wrong place, because on this podcast, we're not going to be pushing the conventional medicine methods or way of thinking about health. If you're looking for another way to live longer and healthier, join me, Ron Nedd, and my brother Dr. Stephen Nedd for this week's body chat about the gentle and effective chiropractic technique, Activator Methods. Me? I'm a retired Twin Cities chiropractor currently helping people buy and sell homes in the Tampa Bay and Los Angeles areas. My brother has a thriving chiropractic practice in the Clearwater area of Tampa Bay, Florida. In this podcast, we're going to chat about all sorts of topics related to health, nutrition, exercise, just about everything having to do with the body. You're invited to listen in to our body chat, but don't forget that neither of us is giving you health advice, so don't rush off to do something without either checking with your doctor first or seeing Dr. Stephen Nedd as a patient at his office. Good evening, Steve.
Good evening, Ron.
All right, so we're going to talk about a topic that both of us know very well, and something that is going to be useful for people to know more about if they don't already know about it. And we're going to be talking about one of the most widely used low-force adjusting techniques, Activator Methods. Now, when did this first come into use and how did it come about?
Well, first of all, Activator Methods chiropractic technique is the most widely used low-force chiropractic technique in the world today, with approximately 150,000 licensed chiropractors trained in it. It's actually the second most widely used chiropractic technique overall behind the manual hands-on approach called diversified technique. So it began in 1967 when two chiropractors and fellow Logan College grads, Warren Lee and Arlen Four from Redwood Falls, a small farm town in southwest Minnesota, decided that an alternative chiropractic approach was needed because of the wear and tear on their bodies from thrusting into spines of their patients using their thumbs. And this maneuver caused extreme fatigue, muscle strain, and frequent elbow injuries because of the elbows striking each other during rapid movement when thrusting into the patient's spines. The actual idea for a push-button chiropractic technique occurred well before this when Dr. Four was a student at Logan College. And the president at the time, Dr. Vincent Logan, called for the development of a push-button basic technique to speed the delivery of the very slow Logan basic technique, which, as you know, is a technique in which the doctor places his thumb on the sacrotuberous ligament on the buttock and pushes with just about 6 to 8 ounces of pressure for an extended period of time. And this does straighten out the sacrum, which is the base of the spine, and it has a leveling effect on the rest of the spine, but it takes a long time. Not very practical. So the first device that Drs. Lee and Four tried was suggested by a local dentist, and it was a dental impactor, which was designed to force amalgams into the teeth. The problem is it didn't generate enough force, so it was discarded. Yeah, and then another dentist patient recommended a surgical mallet that was used to split impacted wisdom teeth. And the sharp tip, which was replaced with a brake shoe rivet and a small rubber doorstop, was fastened to the end. And this became the first functional activator used up until about 1976. But it had its problems because it tended to break with heavy usage. So they developed the first patented activator in 1976, and it was granted a patent. Plus, it was FDA registered in 1978. And then the activator continued to evolve all the way up to the 5th generation of today, which is the first FDA registered and approved cordless electronic chiropractic adjustment instrument. It produces an electronic thrust of pressure at the touch of a button and has an output force of about 9 to 41 pounds with 4 different settings.
Wow.
Yeah, super high tech. Yeah.
And I still have the one that I got in 1980, and it still works.
Yeah.
Not that I'm using it, but it still works. Now, how is the low-force activator adjustment able to cause the same effect with so much less force than the commonly known manual adjusting technique?
Well, the answer to that is Newton's second law of physics. Force equals mass times acceleration. Force is the amount of force that you put into something. Mass is the weight that you're moving, which is always a constant. And acceleration is another word for speed. So if you increase the force on something, you don't need as much speed. But if you increase the speed against something, then less force is required. And so a manual adjustment, when somebody uses their hands, they use more force and less velocity. The fastest human recorded is 81 milliseconds.
Okay.
And it just so happens that the stretch reflex of the body is 27 milliseconds. That's the body's tendency to tighten up when it's threatened by something. The muscles tighten up.
Okay.
So in other words, the humans are 3 times slower than a person's ability to tighten the muscles. So you have to use a lot more force to get something to move.
Yeah. And we're talking about an adjustment. So what's happening is when someone is using their hands and pressing on the back to get something to move in your back, the muscles are going to tighten up to protect the area. And unless you can move faster than 27 milliseconds, which is how fast the muscles react, you're not going to be able to overcome that resistance. And that's why you have to use as much force as you do by hand.
That's right.
Okay.
What makes the Activator cool is that it uses less force, but higher velocity or speed, and it fires in about 1 to 3 milliseconds, which is much faster than the stretch reflex. So there's no resistance.
Right. So that's why you don't need all that force, is because it's moving the vertebra faster than the muscle can resist what is being done. And so you don't have to overcome that resistance.
That's right.
Okay.
And the different settings on it are based on the area of the body that is treated. So, for example, the highest setting, which is 41 pounds, we use that in the pelvis and the lower back because the bones are bigger and the muscles are thicker. And then as we ascend up the spine to the head, we change the setting, and then we get to the lowest setting when we hit the upper neck or when we adjust the skull or the jaw or the extremities.
Makes sense.
Mm-hmm.
Okay.
Another neat thing is that the Activator not only realigns the spine and the extremities, but also resets neurological reflexes associated with pain, muscle spasm, muscle weakness, and various other physical conditions. So it's also a neurological technique as well as handling the spine and the bones and the joints.
So can you clarify what that means by resetting the neurological reflex?
Well, oftentimes you have sort of like a broken record where there's what's called a reflex, or I don't want to get too technical, but you have these things called mechanoreceptors in the joints, which have to do with the position of the joint. And it sends a signal back to the brain to say whether or not it's in proper position. It ends up like a broken record, and there's a reflex where it goes back and forth, where it creates a pattern, and this can cause pain and muscle spasm and so forth. So when you adjust an area where there's a problem of this magnitude, it can reset that reflex and normalize it so it doesn't keep occurring like a broken record.
So that's like the needle skipping on the record, and you're smacking the record player to get the needle to move over, and yeah, something like that. Okay, so that makes sense. Thank you for clarifying that.
Yeah, and one more thing is that you don't hear an audible release or a pop like when you get a manual adjustment, because that obviously requires more force, and that's simply a release of pressurized gas in the joint, not your bones cracking, which some people think it is.
Right. Now, what is a functional short leg, and how is that used to determine what area of the spine or extremities needs adjusting?
Well, what a functional short leg is the appearance of unequal leg lengths when a person goes from a standing position or weight bearing to lying face down. And the trained chiropractor assesses the leg lengths by viewing the area of the shoe where the heel and sole meet, after pushing the feet together, flaring the toes outward, and applying light headward pressure on the feet. So the leg that appears shorter is called the functional short leg. And it's on the side that the pelvis is tilting back and downwards, so it's called the pelvic deficiency side.
Okay.
And by the way, true anatomical short legs are rare and can be due to a birth defect or more commonly a fracture of the thigh or leg bones. An example of that is our mom had a right hip fracture. She fell and broke her hip, and they had to put a plate and 5 screws in there. And as a result, she actually needed a 3/8 inch heel lift for her right leg.
Because the actual leg there was an actual physical difference in the length between the two legs.
Exactly.
Okay.
Now, leg length testing is used in Activator Methods as an assessment tool to first realign and balance the lower extremities, sacrum, and pelvis. But it's also used to determine when, where, and when not to adjust based on the changes in leg lengths while doing the various tests in different positions. So first, the legs are tested when the person's lying flat on the table and the legs are flat on the table to check if something needs to be adjusted.
Okay.
And then the legs are lifted up to 90 degrees to determine which side needs to be adjusted.
Mm-hmm.
And then there's other positions we move the legs to, and they can help us determine whether a joint or a segment is rotated, gone up and down, or sideways.
Correct.
Yeah. And the other thing is there's 3 types of tests that we do in Activator Methods. We do what are called isolation tests. And those are specific active movements performed by the patient to assist in determining the location and evaluation of displaced spinal and extremity bones and joints.
Mm-hmm.
We can also do what are called stress tests, where the doctor pushes in a direction of displacement to determine if it's out of alignment.
Okay.
And finally, there's pressure tests, where the doctor pushes in a direction of correction to see if it will help.
All right, good. So you've got different tests, some where the person is making a movement that activates certain muscles that cause one specific segment of the spine or shoulder or something like that to move or to be isolated. And if there's a problem there, it'll affect the overall balance of the body and the leg lengths. And then you can tell that there's a problem there or that there's no problem there. And the other 2 are ones where you're physically touching or pressing or moving in an area of the body in one direction or the other to tell if something is out or if something is corrected by going in a different direction.
Exactly.
Okay, good. And that is what I got my research award for in 1985.
Wow.
Now, does the validity of the Activator Methods technique rely on just what doctors and patients say about it, or is there any research to back up this technique?
Well, Activator Methods is the only chiropractic instrument adjusting technique with actual clinical trials, 23 to be exact, to support its efficacy.
Mm-hmm.
And it also has published hundreds of clinical and scientific peer-reviewed papers. They've worked with major academic research institutions, and it has received grants from the National Institutes of Health and other recognized entities.
Okay.
It's taught at most United States chiropractic colleges, and it's practiced all over the world.
Mm-hmm.
And all the various tests, and there's hundreds of them now,
Mm-hmm.
of the isolation, stress, and pressure test. They've been submitted by chiropractors in clinical practice and approved by a committee that's assigned by Activator Methods International of certified activator practitioners. In fact, both of us have gotten credit for approved isolation tests.
What was yours?
Mine's a good one for tennis elbow, and I believe yours was one of the earliest approved tests and part of the basic scan, lumbar number 2, both hands on the lower back.
That's correct. I didn't know you
well
had
done.
one too. That's great.
Yeah.
Okay. Now, there are different levels of training for doctors who use Activator Methods. Can you explain what they are and what the difference is between them?
Yes, there's the basic proficiency rated level, and it involves passing both a written and a practical exam. And you must score 80% or better to pass. The fundamental track, which teaches the basic scan, contains the information needed to become proficiency rated. And it's taught at on-site seminars or now through an online course. And most doctors attend at least 2 seminars before taking this test.
Okay.
The advanced proficiency rated level, most doctors attend at least 3 seminars before taking this test. And it's also where you have to score at least 80% on both written and practical exams. And in order to maintain these ratings, activator doctors must attend at least 1 on-site seminar every year.
Mm-hmm. Okay.
Now, I became proficiency rated while I was still in chiropractic college and advanced proficiency rated in my first year in practice in November of 1990, just 3 months after opening my first practice.
Mm-hmm.
I also became an associate clinical instructor for Activator Methods in 2006 and have taught at the Orlando seminar each year up to this year.
I remember you doing that every year.
Yeah.
Very good. So you're one of a small group of doctors in the country that not only have become advanced proficiency rated, but also done it enough times where you're asked to help at the various seminars each year.
That's right.
Excellent.
Mm-hmm.
Now, what type of people is this especially good for?
Well, I believe it's good for everybody, people of all ages and walks of life. In fact, my youngest patient was 15 minutes old.
Wow.
Yeah. The baby wasn't mine, but I did assist with the birth.
Mm-hmm.
The mother was in labor for over 20 hours and her cervix was still at 3 centimeters. And for those of you who don't know what that means, full dilation is 10 centimeters, and that's about when you can deliver. So I adjusted her using the Activator and Logan Basic technique, and she hit 10 centimeters in just 10 minutes.
Wow.
Yeah. And then I adjusted the top vertebra in the baby's neck called the atlas when baby was 15 minutes old, which helped calm her down because she was crying.
Right. And that was using the Activator because you're not going to use anything but something very gentle on a baby.
Exactly.
Okay, good.
Yeah. And my oldest patient was 99 years old. She likely had osteoporosis, which obviously you would avoid doing manual chiropractic on.
And clarify for people what that is.
Osteoporosis is when the bones are very porous. There's a loss of calcium. It's like almost like a honeycomb. So it's very, very brittle, and the person can just, even from sneezing, they can break a rib.
Wow.
Let alone falling.
Mm-hmm.
So it's safe enough to do on basically everyone, precise enough to handle basically every joint in the body from the spine to the extremities, as well as the skull and the jaws.
Mm-hmm.
And another example is our mom. After she had a rough manual chiropractic adjustment plus a neck disc problem that she had, she had to wear a neck brace for over a year. Mm. And I suffered as much as she did because I was the last kid left in the house, and I had to help her with the dishes, the laundry, the vacuuming, and you name it. So
yeah,
she only allowed Activator adjustments on her neck the rest of her life, and the disc eventually healed.
Wow.
Yeah. And one other thing is the Activator can even be used on animals. Mm-hmm. I'm a certified veterinary chiropractor, and I do animal adjustments at my office on small animals, including dogs and cats, after getting written permission from any licensed Florida veterinarian. I've also adjusted horses and birds.
Yes, and I would think that people who are afraid of getting a chiropractic adjustment, or especially of their neck getting adjusted manually where it's turned, or have heard stories about chiropractic that gets them concerned, but they are looking for some kind of help. I think that those would be the kind of people, in addition to younger people or people with osteoporosis or people with disc issues, things like that. I think that there are groups of people that this would be especially good for.
That's for sure.
Very good. Now, is there anything else you'd like to say before we end?
Yeah, when new patients come in, I give them the option of receiving an Activator adjustment and or diversified manual technique. Mm-hmm. If they're referred directly from the Activator Methods website, they only receive Activator technique. And under many circumstances, Activator Methods is far superior to other chiropractic techniques due to its precision and gentle approach. If you want to learn more about Activator Methods and need to find a certified Activator doctor in your area, you can go to the Activator Methods website at activatormethods.com.
Very good. Well, that was excellent. This was brief. This was shorter than the one that we just did on cholesterol, but it was very much to the point. Thanks for sharing all the information. You've done a lot more work in it than I did because I was only in practice for a much shorter time than you were. So that was excellent. And next week, we're going to be talking about sugar blues, which is going to be a very interesting topic. So thanks again for your time, Steve.
You bet.
Thanks for joining us this week on the Body Chat podcast. We both really appreciate your time and your attention. We want to provide you with interesting and informative episodes each week. And if you have a topic you'd like us to cover or any questions you'd like us to answer, send an email to us at info@bodychatpodcast.com. That's info@bodychatpodcast.com. Next week, we're going to chat about sugar and sugar blues. To make sure you don't miss any of our upcoming episodes, subscribe to the Body Chat Podcast now on iTunes, Stitcher, Google Play, or Spotify. See you next week.